Our next speaker is Fung, here to tell us about the experience of implementing antenatal hand expression in a hospital setting. Emily is a clinical nurse specialist in the Women's and Infants Health Program at Mount Sinai Hospital, where she has been directly supporting the Mother-Baby program since 2021. Prior to this role, she worked for 4 years as a registered nurse on a high-risk antenatal unit. Emily currently serves as a co-chair for the Baby Friendly Initiative Committee and actively contributes to several infant feeding quality improvement initiatives across the program and hospital. In addition to her work at Mount Sinai, she practiced as a casual nurse at the Sexual Assault Domestic Violence Care Center at Women's College Hospital. Emily is deeply passionate about perinatal health care and is committed to advancing education and delivering high-quality, compassionate care. Thank you.
Thank you so much. As Julie introduced, my name is Emily Fung, and I'm so grateful to be part of this antenatal hand expression awareness event today. During my talk, I'm going to really give an overview of how implementation worked at my hospital at an acute care center. So some of the objectives here is really focusing on each step of the way that contributed to the success of the implementation of antenatal hand expression in the hospital setting, which we'll dive into each of these topics. And at the end, I will share a summary of my key findings and recommendations that perhaps you and your area can take forward during your implementation time. The first overview really is to develop a working group and a committee, and this can help to have some buy-in from all the different health disciplines in your area. At our hospital, we do have a large women's and infants health program, which is really amazing because we have so many different health disciplines that are contributing to and committed to supporting infant feeding through our Baby Friendly Initiative Committee at Mount Sinai. During our committee meetings, we also identify various different working groups that different staff members can participate in or lead and join. So one of the working groups that we developed back in 2021 was actually focusing on antenatal hand expression. So some of those ideas initially that we thought about was making sure that there was information on our website, creating a pamphlet, creating a guideline, having supplies available, and possibly including the antenatal hand expression practice as part of some of our clinical nurse specialist care plans. As a clinical nurse specialist, we get consults to see patients with a bit more complex history. And in this case, we wanted to have consults for patients who were interested in antenatal hand expression and also who were eligible. As a high-risk center, we do have a number of patients who we maybe would not recommend starting antenatal hand expression with that risk, very small risk of preterm labor, and as Naida had reviewed from the literature. So I think developing a committee and a working group really is going to be the basis of your planning and implementation, especially having those different disciplines involved. In our antenatal hand expression working group, you can see we did have different practitioners from family practice, actually a midwife nurse, from prenatal education. So one of the prenatal education coordinators who's here today, Suji, again, who helped to really ensure that that education was also implemented in all the prenatal classes that the patients attend and join. As the leads, it was myself and my colleague and fellow CNS, and Natalie. But part of the evolving working group, eventually, we did have nurse practitioners, obstetricians, pediatricians, dietitians, as well as social workers, and our communications team too. With the development of our hospital policy, this really helped to outline all of the steps involved with antenatal hand expression from the staff side as well as from the patient side. So with this development, we were able to develop a patient inclusion and exclusion criteria, as I discussed, as with our high-risk population and a low-risk population. We were able to determine some of those criteria based on their pregnancy risk factors, which might include, for example, placenta previa, invasive placentas that we would really try to avoid having them go into preterm labor. And then other patient areas would be individually considered, and making sure that we would review that with the primary care providers involved in that patient's care. Part of the policy helped to dictate the procedure of antenatal hand expression. So including, hopefully, most patients are coming through our prenatal or ambulatory care setting from our clinics. So having a process where it's introduced and at what gestational age are we starting that conversation. So part of the Ontario perinatal health record in a prenatal setting, there is a question to ask patients, typically in their second trimester, their intention for infant feeding. So part of that, we also wanted to loop into the nurse's routine care. So again, we're not adding a new extra burden onto their practice, but involving and just seamlessly integrating that into their routine assessment of adding on, have you heard about antenatal hand expression? Would you like to know more? So part of that, we were able to select and identify patients who were interested so that we could start a smaller population when we first developed the policy to do the education and implementation. We also determined what that would look like for patients at home for collection and for storage. So we'll dive a little bit deeper into that shortly, but making sure that part of the policy that the staff know exactly how to educate patients on doing antenatal hand expression at home, and how to transport that to the hospital when it's time for their delivery, whether they're going into spontaneous labor or whether they had a planned induction or C-section date, for example. We wanted to make sure that there was standardized practice on how to safely and according to our IPAC rules as well, our infection control guidance, to make sure that we had some standards for patients to follow so that, again, all of that colostrum that was collected was safely stored and transported and nothing was going to waste. Part of the admission to the hospital process, we did give some guidance again to make sure that there's some guidance to the staff and expectation for the patients on what that storage procedure looks like. Currently at Mount Sinai Hospital, we do have a human milk fridge in every unit. So one in each unit's medication room. So on labor and delivery, on our antenatal unit, on our postpartum or mother-baby unit, as well as in our NICU, we actually have a dedicated milk fridge to each baby in their own individual rooms. So making sure that everybody was aware of that process and how to store that with the labeling and identifying process on admission with the patient hospital labels. We also identified a bit of guidance for thawing the colostrum and what that looks like, especially, with patients who are coming in for induction or in spontaneous labor. You never know when they're actually going to deliver and when we can actually use that colostrum. So we wouldn't want to, take it out too early ahead of time, where the milk is going to, come to room temperature too soon and maybe go to waste, or taking too much time to thaw where it might still be frozen and not readily available after birth. So giving some guidance around that as well to make sure, again, it's safe and follows our infection control practices. For the indications for use, ideally, a lot of these patients who are doing antenatal hand expression are hoping to provide their human milk. So whether that be also in conjunction with breast chest feeding, with pumping, or hand expressing after birth. We wanted to make sure we're supporting their primary feeding goal. In addition, having, like Lauren was saying, this insurance milk on the back of their pocket. So whether that be, initially starting the breast chest feeding journey and having the latch go, and then topping up with the collected colostrum as a supplementation, or again, for those parents or babies who are having hypoglycemia monitoring or the protocol, that we, instead of going right to formula for supplementation, that we are able to use their collected colostrum as supplementation for that reason as well. So a bit of guidance and different variations of indications for use. For the administration of the colostrum, we don't support syringe feeding in the hospital, although that is the collection method that we're teaching parents to do at home, especially when it's smaller volumes, that we make sure we're kind of decanting essentially from the syringe into different formats. So whether that be into a little medicine cup, into a spoon, directly on the patient's breast or chest at their nipple. So again, that baby can suckle the drops from the chest, or onto their finger into a feeding if there's enough volume, into a bottle with a nipple as well. So again, different ways to administer the colostrum safely, and again, not directly from the syringe, so that it can be baby-led. Upon discharge, we of course made sure to have some guidance on what that process looks like. So whenever we're transferring between units, we're also doing those double patient identifiers and transporting the collected colostrum between the unit milk fridges. So nothing gets lost. We're making sure it's all labeled correctly with the date and time of expression. And then on discharge, making sure that we're documenting that the patient is going home with a collected colostrum syringes, and double checking that if there are any syringes left over. We have had scenarios where patients have forgotten, or the nurse has forgotten, and calling the patients back in a timely manner, doing frequent milk fridge checks as well. So usually our charge nurse or one of the nurses will support that on their daily kind of equipment check shifts. And so hopefully that we can make sure that nothing ever goes to waste. Part of the education and spreading of awareness, we were able to add antenatal hand expression section to our Sinai Health website. This is actually a new revamped version of our website from last year. So really making sure that all the information is easily accessible to your patients and your families, I think is really huge. And also for even staff to give guidance to, hey, here's a website, let's just teach from there. Here are all those topics, and then you can get more information. So again, they don't have to memorize every single detail, although of course, eventually, now we're at that stage where it is normalized into their everyday practice and into their everyday knowledge. But at the beginning, we wanted to, again, make it seamlessly easy as possible for everyone to adopt and spread the awareness. So I think if you have ability and access to adding your resources and information to different formats, whether it be printed or electronic, like on your organization's website, I think that's a really helpful point. And of course, utilizing that as a teaching tool for your staff and patients. In addition to the education that we provided verbally, we also developed a healthcare provider guide. And this really just gives a nice snippet of summary outside of the policy, where it's a bit more detailed. So it's a bit of a snapshot about the healthcare provider's role in antenatal hand expression, why it's important, and some safety and considerations for risk factors. Understanding those benefits for parents and for the babies. Understanding where and what our colostrum collection kit involves, and I'll go into that a bit later as well. And then what that process, again, snapshot looks like in bullet points in the hospital when the parents are coming back, how much to bring, how to store it, how to transport it, what is the feeding guidance or indications, and making sure that this was a nice, easy tool for all of our staff, not only nursing, but including our lactation consultants, our OBs, our midwives, and that everyone was comfortable with understanding the information and how they can support antenatal hand expression for patients. On the patient side for education, we also developed a patient brochure. And again, more detailed information on our website, but a lot of the condensed information is on this brochure. So this could be easily handed out with the routine prenatal appointments when they're getting all of their information at those different times in their trimesters. This is a really helpful tool for patients to take it home, read through it, mull on it, and then come back with any questions or concerns the next time they return to clinic or to the hospital. So this is available in our prenatal clinics as well as in our inpatient antenatal unit. So different, again, different areas where the exposure can be shared. On our patient brochure, this is just the back side. So I'll flip, this is the inside. So this is the first thing that patients would see. Again, going over similar to the healthcare provider guide, what antenatal hand expression is, why it's important, what is colostrum, and then benefits for parent and baby, how to do it in a step-by-step manner with a little diagram of the hand expression steps of press, compress, and relax. And we also did link the QR code to Naida's team, the More Milk Sooner website, to that amazing video that we briefly saw. So I think with that, in combination, sometimes some nurses or ourselves as a CNS team would be able to actually do some hands-on practice with the patients in clinic. So they're comfortable, they know exactly the technique, they're doing it properly. And again, at the end of the day, that stimulation is truly so key. Whereas I always try to set that expectation that maybe not everyone is going to be able to express or collect any colostrum. And that's okay, because our two goals are that early stimulation and hands-on practice for the parents so they feel comfortable after birth, how to hand express. And we know that hand expression is also the first steps to breast chest feeding or that initial latch. So I always try to stress that those are the two main goals. And it's a bonus to be able to express any colostrum and collect it. So not putting any pressure, normalizing that they might not see or be able to collect, even if it's very tiny amounts that they're able to express. It's okay if they can't collect it, because the important parts is the other two, the stimulation and the practice. However, on the back side of the patient brochure, we do have the collection and storage guidance there. And with that guidance, we do indicate for patients to only bring enough for a 24-hour period, roughly. So between 1 and 15 mils. Again, thinking about that delay in the time of being admitted to the hospital and then actually delivering baby. So sometimes it could be anywhere between 12 to 24 hours, let's say on average. So we don't want any of that milk to be wasted, as we're asking them to store it in their freezer at home. Which for the level 1 term baby is good for 6 months in the freezer. And then typically we say 6 days in the fridge. Oh no, someone is clicking. Sorry, we'll go back. Oh. Okay, sorry about that. So any colostrum that is being moved from the freezer storage to the fridge. So now in the hospital, we only have the milk fridges. So again, that's a change in that temperature control and a risk for introducing bacteria. So we make sure that from freezer to fridge that we're going to use that colostrum within 24 hours. And then from freezer to fridge to room temperature, again, we're giving guidance to our nurses and the patients that we want to use that colostrum within 1 hour for the infant ingestion. For any colostrum that has passed that safety guidance of timeline, we do inform our patients and nurses that they can actually still use it externally. So even if we're not identifying that it's safe for baby to ingest at that certain time, if it's past the 24-hour mark from freezer to fridge or past that 1 hour mark from freezer to fridge to room temperature, they can use it on their own. Oh, someone could stop clicking. If they could use it on their own, nipples or any kind of cracked areas on their breasts, we know that colostrum has all those great antibodies so that it can support the healing with any cuts or concerns. And same goes for baby. So using that colostrum externally, if they have any scratches on their face, or eventually when they do have their first or their newborn bath at home or in the hospital, they can always mix the colostrum into their bath water. And of course, we also talked about making sure that we're still supporting their infant feeding goals. So if that's breast chest feeding, that's always going to be the primary. And these colostrums are always going to be an extra snack, a top up, or for backup. For any extra colostrum collected at home, we do advise patients that they can definitely use the colostrum in other ways. They could mix it later on into their milk at home if they're doing combination feed, or into their soft foods if they're starting soft foods later on at 5 to 6 months, for example. Or if they have an older child at home, again, they can mix that into their bath water or their foods as well. So again, different ways that they can utilize the extra colostrum that they've collected or any kind of past ingestion safety time of colostrum. And I know on the brochure it does say room temperature for 6 hours, but we do clarify that if they express fresh colostrum in the hospital, that can stay at room temp for 6 hours and that's safe. It's just when we're changing that temperature from freezer to fridge to room temp, that's where we give the guidance for the use within 1 hour. For the thawing, we actually try to avoid, I know there's lots of, different techniques that people have used. In the past, we've heard about, putting it in a water bath, for example, or something like that. But really, ideally, we just let it either sit at room temp, and with the smaller syringes, of course, it should already thaw from freezer to the fridge and then to the room temp. It should only take a couple of minutes to kind of warm up. Or the nurse or the patients can definitely kind of roll the colostrum in between their hands to warm up, or just put it in their breast or chest or on their armpits using the body heat to warm up. So again, trying to minimize any risk for bacteria introduction. And also part of that is when they're transporting the colostrum to the hospital, we recommend putting it in a cooler bag that is with a freezer pack. So not a bag of ice cubes. Ice cubes can melt, and again, not regulating that temperature control during the transport very well, whereas the freezer pack is a bit more guaranteed for longer durations of transportation. For patients who live close, we recommend that they actually have someone bring it close sooner or closer to time of delivery if we can predict, or if they have support people available to do that. If they're from far though, and a lot of our patients are not from the GTA at Sinai, so again, making sure that we're limiting the amount that they bring so nothing goes to waste when they're bringing it. For the hand expression guidance, we are letting patients know that the frequency should be twice a day for 5 to 10 minutes at a time, alternating between both breast and chest tissues each session. We do recommend that they monitor for any abdominal cramping, uterine cramping, or contractions in between each session. So for example, I would tell my patient to do the session in the morning, and then monitor throughout the day if they do get any cramping, take some Tylenol or rest, relax, whatever pain measures that they use, and then see if it goes away. If it's not an issue, go ahead and continue that nighttime session. If it persists and they're a little bit concerned, that's okay. Skip that nighttime one and try again the next day. And maybe instead of 10 minutes, you're doing 5 minutes. So we're limiting the amount of time so that we can minimize some of those side effects if the patient is feeling them. Out of like an average of 10 patients, let's say, I think about probably 4 out of 10 actually feel some sort of light abdominal or uterine cramping. So again, just to give a bit of an from my experience anyways, the amount of patients who actually feel any side effects at all. Okay, so moving forward to the access and availability of resources, we were able to work with our Sinai shop, which is an independent business part of Mount Sinai, that to develop a colostrum collection kit. We know there's colostrum collection kits, on Amazon, on other websites. You can just get sterile syringes from the pharmacy or the store, as Lauren was mentioning as well. And a lot of times, sometimes when they're ordering their breast pump as well, it might come with some colostrum collectors. But we really wanted to make it simple, easy, and again, affordable and accessible for our patients and families. So we were able to develop a colostrum collection kit that had 2 sizes. So kit number 1 includes 5 1 ml syringes and 2 3 ml syringes, whereas kit number 2 includes 7 1 ml syringes. So again, depending on how much colostrum patients are actually able to express, that might determine which volume of syringes they're going to purchase. We also included in the kit a 30 ml collection cup. So it's just like a little medicine cup, just for ease of collection. So patients can express directly into the medicine cup and then draw it up with a syringe. As Lauren was saying, she used a shot glass, which is awesome, super, super helpful as well. So in that same thinking, we wanted to make sure that it was easy to do for patients and families. Some patients are a bit more advanced, and like the video that Naida was showing, they could draw it up directly from their nipple as well using the syringe. But that's not always an easy technique, or if you don't have a support person there with you when you're doing your antenatal hand expression, it's a bit easier for them to just express directly into the medicine cup and then draw it up with the syringes afterwards. Part of the colostrum collection kit, we also include expressed milk labels. So they're sticker labels that we include with each colostrum collection kit package. So it has the name, date, and time fields for them to fill out. We always let them know to try to use the oldest colostrum first. So again, nothing goes to waste with all of those timelines we talked about. And this is especially helpful when they're bringing it into a hospital, so the nurses can also help identify which colostrum syringes to use first, etc. For the accessibility, at first we were just selling through the Sinai shop, which we do have a physical location inside the hospital building. For those folks who don't know, at Mount Sinai, we do have a clinic building, which is 2 doors down from our actual hospital building. So all our prenatal clinics are actually at this separate building. So in light of that, we were able to actually have a storage of colostrum collection kits at our clinic building in one of our maternal disorders clinic. And recently, we also expanded to another low-risk OB, her office directly, because she is a huge advocate for antenatal hand expression and infant feeding. And she actually always promotes it with her patients. So she has quite a large population of patients who are interested and actually adopt antenatal hand expression. So again, she has some, and there's some in the maternal clinic. And then we also sell it at our Sinai shop on the 17th floor in the hospital building. During after hours, because the Sinai shop only operates during the daytime, we have made it accessible also 24 hours pickup in our mother-baby unit. So with our mother-baby unit, that is where our postpartum patients go. And there is a charge nurse and a ward clerk, or a unit clerk that is staffed 24/7. So again, having 24/7 access. And we developed this colostrum collection pickup kit. So like a little tracking tool where patients purchase the colostrum collection kit online. They receive an email with their invoice number. And then they take that invoice number email for the wherever they're going, to clinic or to the mother baby unit, where they can then jot down the order number, and we're able to provide them a kit right away. So they don't have to wait or walk back from clinic to the hospital to grab the kit. So again, making it accessible in different areas in different ways for your patients, I think, is truly key in supporting this practice. Ideally, I think in the future, it's part of my one of our BFI goals to make sure that we can actually find some funding to support giving the colostrum collection kits for free. I think that would be huge, again, on the ease of uptake for patients. So hopefully we can do that in the future as Naidi and her team does. With the education and practice, we utilize the BFI 10 steps for guidance, which we developed a kind of a varied version of our baby feeding timeline in assisting parents following their infant feeding progress during their hospital stay. So we adapted this poster from the Best Start website, which has the baby feeding timeline from birth to 48 hours. It outlines at each stage in the first 48 hours of life, how many feeds are expected, what things they can do, skin to skin, latch, hand express, their tummy volumes, wet and soiled diapers, expectations, and then some tips about getting help. So part of the Best Start is mainly the center part. And what we've done to adapt is actually added both sides on the right and the left side is the cues for feeding on the left, where it goes into early cues, mild cues, later cues, and the right side where we added skin to skin, how to latch, and how to hand express. So again, giving that guidance and reinforcing it in different ways throughout the pregnancy journey, as well as in different formats throughout the hospital setting, I think is really, again, helpful and important for that continuity of antenatal hand expression awareness and implementation. These posters are printed and available at each bedside, actually, of our postpartum unit. There are a few on our antenatal unit and also in labor and delivery in the labor rooms. We've also had a few posted in our clinic areas, again, just setting those expectations ahead of time. This poster is also available on our website. For the documentation, so again, supporting our nursing staff to make sure it wasn't something challenging or a new workload they had to adapt and a burden to their everyday practice. We really wanted to seamlessly integrate that into their workflow. So part of that is making sure that there are easy fields for hand expression documentation, not only for in the infant's chart, but also in the maternal chart, which I will show shortly. Part of this also adds to helping pull the data for data collection for when you're doing chart audits. So again, we can show what is the actual uptake of hand expression, how many people are actually bringing collected colostrum to the hospital. So in the maternal chart, as you can see, we do have a bunch of different indicators. A lot of them are from our born indicators, as well as BFI indicators and hospital indicators that we've developed. Born, for those who might not know, is the Better Outcome Registry Network, and they compile and compare data from all the birthing hospitals in our province of Ontario. So again, that's a great way that we were able to integrate antenatal hand expression to ongoing initiatives we already had going on. Diving into data collection. So luckily at Sinai, we do have an auditing and reporting team that helps on our back end of our electronic medical records, so our EMR system, to pull from all those fields that we've indicated for our hand expression data, to make sure that they're able to collect the data, pull it easily, right? Not adding on so much work to another team, another provider, and then generate these graphs for us to show that that we're really meeting over our benchmark targets. And again, those are those provincially set targets from Born. As you can see, we've been doing pretty well since the start of antenatal hand expression implementation in 2021 to most recently in this graph is September 2024. There were a few times we had dipped below the benchmark back in 2022. And a lot of it, when you look back at those timeframes in healthcare, we were experiencing a large shortage in health human resources. So staffing challenges, nurses leaving the hospitals, finding travel nursing contract jobs, working outside in the community, in clinics and public health. So during that period, we did note a lot of our charting was condensed to meet those staffing shortage needs. So they would do a nursing status summary, let's say, or a text summary of the care they were providing versus going into each of those clicking, we call them iView, our bands to actually check off each item. So a lot of our data was actually missed because of those documentation gaps that was happening. And a lot of the times, we know the practice is happening, and sometimes it's just challenging to find the documentation field. It's challenging to find time to document that field. So we know that documentation gaps from the staff side also contributes to the ultimate data that you're able to collect. So really honing in documentation as part of your education, again, so key, and making sure that we're able to capture the actual picture of how we're doing in supporting patients to complete antenatal hand expression or hand expression in general. Other ways we were able to spread awareness was inviting, for example, Naida and her team to our obstetrics and gynecology grand rounds. And this was back last year, March 2024. It was a huge hit. Lots of people showed so much interest, and especially the obstetricians, adopting that and again, normalizing that into their prenatal care and their prenatal appointments with the patients, so that they're also bringing it up in addition to the nurse bringing it up, in addition to possibly patients being able to see it on our website, learn about it in our prenatal education classes. And of course, social media had a huge uptake and influence on this as well. But I think inviting, other care providers or presenting at different forums with different disciplines is super helpful to, again, the ultimate implementation of this practice. Other ways we spread awareness was highlighting patient stories. So during Breastfeeding Week, National Breastfeeding Week back in October last year, we were able to highlight 2 family stories. One on the left was a level 1 or term baby population, and then on the right was an NICU baby and family story. Through these patient stories, as we heard from Lauren, it's so motivating for care providers and for patients and families to hear really how impactful antenatal hand expression is to support their infant feeding goals and their ultimate journey, as well as the development and well-being of their newborns and their children. You might recognize I'm there on the left. I am biased, of course, because that patient was also my colleague who did amazing with her antenatal hand expression, collected tons of colostrum, and was able to successfully meet all her goals and having a good milk supply after delivery and supporting her baby boy, Soren, there to successfully continue to still breastfeed now at 18 months. Unfortunately, she wasn't able to join us today, but if you'd like to see her story, there is a video link again on our Sinai Health website that you can check out and watch. So key findings and recommendations, just again to summarize everything we've talked about today. Organizing a working group, having those multidisciplinary teams involved is so important to not only have buy-in, but really make sure that everybody in your program is on the same page and supporting the same goals of infant feeding, and specifically with the adoption of antenatal hand expression. So whether that be midwives, LCs, dietitians, educators, communications, working with our communications team to develop those Sinai Health news stories and highlight those patient experiences. All of those have such a big impact to really the ultimate goal of success of implementation. Demonstrating that ease for providers to adopt, so highlighting that it's minimal added work to the current practices, identifying opportunities to implement into their current workflows, like during the prenatal appointments, having the antenatal hand expression brochure incorporated into the prenatal booklets that are already happening, integrating into the curriculum for the prenatal education classes, making it a routine question for antenatal inpatient admissions, and of course having availability of the posters and brochures in the clinics and in the hospital setting. And with that, creating that availability of access to resources and tools for your staff and your patients. So working with your hospital stores or shop to provide those colostrum collection kits if it's possible. Building in these auditing structures to share your data, working with your IT or data or auditing teams, and highlighting the importance of those BFI and born indicators. Again, showing how much work and success is going on really helps to continue and sustain this practice. Advertising your successes, so working to share those patient stories with your staff and with your community, collaborating with different nursing or medical rounds, spreading that awareness and education. And again, with that sustainability of practice, continue to highlight these practices and impacts over time, updating your policies and resources as new evidence comes to play, or as NIDA publishes their results, including that into your policies and your guidelines. For us, future directions that I'm thinking about now is continuing to expand those pickup locations of the colostrum collection kits, and expanding all of the OB clinics where the patient brochures are available, and into our midwife partners, etc., and different family practice teams that are involved with Sinai. Truly, at the end of the day, all of this does take a village. So thank you all for taking time to join us today to learn more about antenatal hand expression. I'm so proud and grateful to be part of this group and presenting our journey so far at Mount Sinai. If you have any questions, I'm always feel free to reach out. Happy to